and welcome to 2-Minute Tips for Autism. I'm really excited. I have one of my favorite people here, Dr. Rossignol, because he's not just the most amazing doctor, but he's also my son's doctor, so I want to let you guys know that. And I am just so grateful that I know you're super busy, and you're here taking the time out to talk to us. So thank you for being here.
Thanks for having me.
So first of all, why are you so passionate about what you do?
Well, I have 2 kids with autism, and that's what got me into this field, trying to see is there something out there that can help them, and then seeing them improve over time with some of the treatments that are available, and then translating that into treating other kids with autism.
So you eat, breathe, and sleep autism.
Pretty much for a lot of my time. So yes.
And so we hear a lot about seizures and autism. Can you kind of explain that? Because it's kind of confusing.
Right. So seizures are where you get abnormal brain patterns, electrical signals in the brain. And most of us that think about seizures think about someone falling down, shaking all over. But we now know that some children with autism will have seizures in certain areas of the brain that you can't see. And wherever the seizure occurs, that area of the brain might be disrupted as far as function goes. For example, we know now that some kids with autism will have seizure in the speech area, and that will lead to impaired speech.
Okay.
We now have studies showing that some children who have seizure or seizure-like activity in the brain in certain areas will have more self-stimulatory behavior, they'll be more aggressive, more obsessive, sometimes, again, they have the impaired speech and so forth. So what we're doing is we're looking at kids that may be having seizure activity in the brain that you can't see on the outside.
So it doesn't look like a typical seizure.
Right, exactly. So about a third of kids with autism will develop epilepsy, where they might have a grand mal seizure, fall down, shake all over. And that's because they're having a seizure in their brain that controls arm and leg movement. But if the seizure occurs in the speech area, you might have impaired speech.
Okay. So
about a third of kids with autism will have seizure or epilepsy. About another third will have an abnormal EEG where they don't have activity you can see, but there's abnormal activity in the brain that's impairing brain function. And about a third will have a normal EEG. So you can't always tell by looking at the child that they have seizures. Okay. Sometimes you will see things like staring spells where they just kind of freeze
and kind of space out.
Yeah, and stare off into space. It could just last a few seconds, and that could be a seizure. But what we're finding is that some children with autism have seizures. You can pick it up on an EEG, but they may not have anything on the outside that tells you the seizures. So generally what we recommend is that most kids with autism, if not all of them, get an EEG done. And we want to get a sleep EEG, so it's a 24-hour EEG, because some children have seizures that occur at nighttime but not during the day, and so forth, in order to test and see if there's a problem. And what we're finding is if you don't test, you might not pick it up. If you test it and pick it up, then you can decide at that point what you're going to do about it. But first you got to know whether or not there are seizures going on, and you can't always tell by looking at the kid. It's kind of like taking a blood pressure. You don't know if it's high until you test it.
Absolutely.
So you can't look at someone and say, oh, your blood pressure's high. Let's test it first, see if it's abnormal, see if there's seizures, then we can decide what we're going to do about it. So.
Wonderful. Well, thank you so much.
No, thanks for having me.
And if people want to know more about you, how do they find out about you?
So they can go to my website, which is rossignolmedicalcenter.com.
Okay, wonderful. Thank you so much. And thank you guys for watching 2-Minute Tips for Autism. Until next time. Bye, guys.